What symptoms indicate the high blood pressure?
In our medical terminology, we call silent killer. Many times the patient ignore the high BP, thinking that they don't have any trouble, but this is very wrong.
Can you tell me what is the main root cause of high blood pressure?
If you say genetic is the
Yes.
any family history of blood pressure or high BP, then the next generation will have high risk of blood pressure.
And doctor, can you give me one or two effective tips to self-monitor at home?
We are using the electronic BP apparatus,
Yes,
and first reading will be on higher side.
true.
So that because of this, we have to take different readings, at least three
Okay.
readings, and then lowermost reading or average of three readings you have to take.
What kind of food people should take and avoid?
We suggest DASH diet to the patient. Dietary changes should be done. It should be high intake of potassium. Means food should be there. Green leafy vegetables should be there, and avoid fatty foods. These junk food they have to avoid.
What kind of exercises people should do?
Before joining the exercise, we have to do the ECG. Otherwise, we say कि somebody is collapsing in gym or doing
Yes,
exercise. Why
yes.
this happens? Because they don't know what is inside, what ECG changes our heart have.
Hello everyone, I am Rupal and I'll be your host for today's episode of Heart Talks, and today we'll be talking about something very important, that is hypertension or high blood pressure, and it's something that affects so many people and yet it remains widely misunderstood. So to clear our doubts, today we have Dr. Dnyanoba Bhaskar with us, who is diabetologist, general physician and internal medicine specialist with 23 years of experience, including 17 years as specialist. So thank you so much, doctor, for joining us today, and I'm super excited to have this conversation with you.
Thank you for inviting me.
Yeah.
So, if you have any questions, that
Yeah, so we'll be starting with some basic questions. Like, first of all, just explain to our viewers that what is hypertension?
see basically, as you said, hypertension is very common, and hypertension means high blood pressure. So what happens because of aging, our arteries get toughened, they become stiff, and
Okay.
because of this, blood pressure increases above normal range. So this is hypertension.
Okay, doctor, and can you tell me what values indicates as higher or normal BP range?
So basically, normal blood pressure is 120 and 80.
Okay.
So if below 120, 80 is normal.
Okay.
120, it increases above this, then it we call hypertension. But this is not a straight way one line definition. There is a classification of hypertension as per the
Okay.
JNC 8 guidelines.
Okay, and doctor, can you tell me what is the ideal range for BP for elderly patients?
So elderly, because if you take the age group for a pediatric patient, blood pressure range is different. Then middle age, and then elderly patient. So elderly patient more than 140, 90.
Okay, so is it different for low BP as well?
Yes, if it goes below 90 by 60, 90 systolic and 60 diastolic blood pressure, it is a low blood pressure.
Okay, and what symptoms indicate the high blood pressure?
This question is very important because many times blood pressure is silent. So in our medical terminology, we call silent killer.
True.
So silent killer, why? Because there are no signs and symptoms. Patient is unaware about the high blood pressure. So I would like to tell you that many times the patient ignore the high BP, thinking that they don't have any trouble, but this is very wrong.
Yes.
But certainly in some patients, they get some symptoms like headache is there, palpitations, and sometimes chest pain because of other symptoms like kidney damage may be there.
Yeah.
So it depends upon what is the underlying cause.
Yeah, that
So
means there are multiple reasons for that. Yes. And can you tell me what is the main root cause of high blood pressure?
See, there are different causes of blood pressure. Means, if you say genetic is the
Yes.
any family history of blood pressure or high BP, then that next generation will have high risk for blood pressure.
Okay.
Then kidney damage, or peripheral vascular diseases. Like the different causes are there.
Okay. So, is it true that stress alone causes chronic hypertension?
No, certainly stress only doesn't cause high BP, but for some time, stress definitely increases the blood pressure.
Okay. And doctor, can you tell me what are the risk factors for high blood pressure?
So, most important, I told you, it is a genetic cause,
Okay.
underlying cause. Next is aging. As the
Yes.
age advances, risk of
Hmm.
high BP increases.
Okay.
Then kidney damage,
Yes, yes.
peripheral vascular diseases. So these are different kind of high risk.
So basically, kidney failure is something which is very common.
Yes,
Okay, okay. And is it true that elderly people are at greater risk of getting high blood pressure?
definitely they are at high risk because of aging, as we have discussed. But it is not the case
Okay,
nowadays. Younger population is also suffering from high blood pressure,
okay,
and because of high intake of caffeine or any secondary causes of hypertension,
okay.
stressful lifestyle. So there are different causes for blood pressure in different ages.
And which complications are involved in high blood pressure?
So there are certainly BP causes different kind of damages.
Okay,
In eyes, they can cause vision loss, then paralysis,
okay,
stroke, then cardiac damage, heart attacks,
okay.
congestive cardiac failure,
Mm-hmm.
then kidney damage
Okay. Kidney
because
damage is
kidney
the,
damage.
yes, main cause.
Yes.
And doctor, can you tell me how to monitor blood pressure?
See, monitoring blood pressure in office is different.
Hmm.
Means what we see,
Okay,
and another is home monitoring of blood pressure. That
okay,
is done by the patients.
okay.
So at home, if patient is checking the blood pressure or
Hmm.
monitoring, he has to sit quietly for 5 minutes,
Okay,
and his arms should be resting,
okay.
and he should apply the adequate BP cup size to the arm, and there should not be any cloth or anything,
Okay.
and they should check
So
at
your,
least 2 to 3 readings and take average of that readings,
yeah, so basically your hand should be bare.
bare
Yes.
hand and rested.
Okay. And if someone wants to self-monitor at home, what are the accurate steps to do that? Like if you give me 5 steps, what are the correct steps to do
Yeah,
that?
basically, patient has to sit quietly for 5 minutes.
Hmm.
They should avoid coffee, drinking, tea, etc. at least 30 minutes before. They should not do exercise 30 minutes before.
Okay.
And the arms should be rested, and bare arms should be there. And they should apply the BP cuff. Adequate size is equally important. And adequate BP measuring machine should be there,
Okay.
standardized.
Okay.
That is important. And they should check the 3 readings, and average of 3 readings they have to take.
Okay. And doctor, can you give me 1 or 2 effective tips to self-monitor at home?
Yeah. Uh, Basically, at least they have to do timing is very important. They have to
Okay.
fix the timing for blood checking.
So basically
Either
their
morning,
daily
evening.
schedule.
Yes, means morning or evening.
Okay.
That should be fixed. And all precautions they have to take, because they should be relaxed. They should avoid the coffee and tea, avoid exercise at least 30 minutes before, and then sit quietly and take the 3 readings, and
Hmm.
again that average of 3 readings. This is very important because we are using the electronic BP apparatus,
Yes.
and first reading will be on higher side.
True.
So that because of this, we have to take different readings, at least three
Okay.
readings, and then lowermost reading or average of 3 readings you have to take.
Okay. So basically it's a whole strict schedule.
Yes.
You have to take care of yourself.
Yes, and they have to maintain the log. They have to record it at what time, what was the level of blood pressure,
Hmm.
and at what time it was their date, timing, and reading. They have to maintain
Okay.
this.
Okay. So doctor, as you mentioned before that hyper blood pressure is also called as silent killer. Can you tell me something more about it? Like why is it so and is it scientifically proven?
Yeah, because why silent killer? Because patient is not aware of this disease. which is very dangerous.
Hmm.
And even if patient's blood pressure is 200 and 120 or 110, patient is not aware. And one day patient will end up with the problem, complications we say,
Hmm.
like intracranial bleeding,
Hmm.
means brain hemorrhage,
Oh,
you know, then kidney damage,
okay.
then loss of vision, because it
Okay.
damages the eyes also.
Hmm.
So these complications will be there, and
Okay.
these are life threatening. That's why we
Okay.
call silent killer.
Oh, okay. So, doctor, can you tell me some tips or can you give me some tips to manage blood pressure? Like, if someone is on the initial stage, what they can do?
So most important is we have to frequently check the blood pressure,
Okay.
3 monthly, 6 monthly, 1 yearly, depending
Mm-hmm.
upon the risk of the patient.
Okay.
Then lifestyle modification is very important. People
Okay.
usually forget the lifestyle modification, means weight control, regular exercise, at least 150 minutes per week exercise is needed.
Okay.
And that also you have to combine different type of exercise. They should
Okay.
not do only one type of exercise.
Mm-hmm.
Sometimes what patient do, they do only yoga, meditation, and they forget the resistance exercise, then aerobic exercise.
Hmm.
So they have to combine aerobic exercise, then resistance exercise,
Okay.
yoga, meditation. And they have to do this. This is
Okay.
lifestyle. Then they have to avoid the alcohol,
Hmm.
wine, etc. Avoid fatty foods.
Okay.
Avoid high salt. Salt content should be less in diet.
Okay.
They should increase the green leafy vegetables in their diet and take the medications as advised by doctor and come for the follow-up at least 3 months or 2 monthly, or if it is well controlled then 6 monthly is also fine sometimes.
Okay. So, if we talk about lifestyle, so doctor, can you tell me what kind of food people should take and avoid?
So basically we suggest dash diet to the patient,
Okay.
hypertension patient. Means what is dash diet? Means dietary changes should be done, which should be high intake of potassium, means food should be there, green leafy vegetables should be there, and avoid fatty foods, less salt food. So this is a dietary changes.
Okay.
So they have to do this.
Okay. And they should strictly avoid junk food,
Junk food,
street food as
obviously,
well.
because nowadays we see younger people, they are very much attracted towards the fast food. So this junk food should they have to avoid.
Okay, so as you mentioned about exercises, can you tell me what kind of exercises people should do? Because there are a lot of people with misinformation that doing heavy exercises while having BP is okay.
Yes. Before that, I would like to tell you, before joining the exercise,
Hmm.
we have to do the ECG, check your
Okay.
blood pressure.
Yeah.
This is very important. Otherwise, we say कि somebody is collapsing in gym or doing
Yes.
exercise. Why this
Yes.
happens? Because they don't know what is inside, what ECG
Hmm.
changes our heart have,
Okay.
and because of this, they'll end up with the problem.
Yes.
So they have to join the gym or doing the exercises. So they have to do the aerobic exercises.
Hmm.
They have to do the pranayam, yogasan, meditation. This is important.
Yes, but heavy workout session is not
Not
advised in most
advice.
cases.
Yeah.
Okay. And if we talk about patient with hypertension, how many times they should visit a doctor's clinic?
See, it depends upon the blood pressure level.
Hmm.
But if it is well controlled, then 2 monthly or 3 months,
Okay.
they should come for the follow-up. They should check the
Okay.
blood pressure.
And doctor, if we talk about this information about hypertension, so there's a lot of misinformation over the internet and people are following anything. So there are
Yes.
lots of myth and queries of patients and they are always confused what to do and what to not. So I do have few questions about the myths.
Okay.
So one of them is what patients should do if they misses their daily medication of hypertension.
Yes. Nowadays, lot of information is available on internet.
Yes,
So internet information should be authentic,
true.
and this should be scientific. So basically, patients should avoid taking the advice from unauthorized people. They should follow
Hmm.
the doctor's advice. They should take the medications on time
Hmm.
and check their blood pressure, whether it is
Okay, okay.
controlled as advice or as per the guidelines it is there or
Okay.
not.
Yes, true. And doctor, can you tell me what a patient can do if they misses their daily medication of
Yes, so yeah,
hypertension?
that question remain.
Yeah.
If patient misses the medicines, as and when, as soon as he or she remembers the medicine, they should take it.
Okay.
But they should not take it too close to the next dose timing.
Okay. So is there any specific time
If
period?
morning dose is missed and they remember in the afternoon, okay, they should take it, but
Okay.
not to the next day morning.
Okay. Okay.
So they should avoid
And doctor,
doing
can you
this.
tell me if fluctuation of blood pressure is normal or not?
Yes, because it is a dynamic factor. Blood
Okay.
pressure is a dynamic factor, and patient sometimes say कि that doctor has checked my blood pressure. It was a different reading. When I check at home, it was different reading, and when I come to the OPD, it is a different reading. Why this happens? Because environment affects blood pressure. So, not, in the morning time, blood pressure is on higher side. As the day passes, and in the evening time, blood pressure is on the lower side. So
Okay.
this is called diurnal variation, and in the night time, it is the lowest blood pressure.
Correct. And as you said that people don't take these things seriously, so what someone should do if they left their hypertension untreated?
As we have said that if blood pressure is treatable cause, we can prevent the complications, deadly complications.
Okay.
So we can treat it and we can prevent the complication. Nowadays, medicines are widely available
Correct, correct.
and cheaper medicines are also available. And if you treat the blood pressure on time and in optimal levels, we can prevent all the complications related to high BP.
Okay. So initial care is the best, as
Yes.
everybody says.
Yes, yes.
Yes. And let's just say if someone who is very fit and fine, does he or she still has to care about hypertension?
Yes, because uh, there are different type of risk factors. So patient looks fine, but genetically he is exposed to developing high BP.
Correct,
So
correct.
he is not aware of it.
Okay.
So even if patient is looking fine or well, it doesn't mean that he is not suffering from blood pressure. Unless you check it, you cannot say he is or she is suffering from high BP.
So even a fit person should at least do a monthly checkup.
I will say not monthly, but 6 monthly, yearly they have to do the checkup.
Okay, okay. Just to know that they are fine.
Yes.
And there's one of the most common myths, and I don't know if it's myth or not, but is it true that salt is the only main dietary culprit in hypertension?
No, no, no. It is not the case. Many times patients think that high salt intake is the only culprit for high BP. But different reasons are there, different causes are there for high blood pressure.
Okay. And there are so many people who literally avoid salt in their food. So is it like normal or what?
No, there is no need to stop the dietary salt completely.
Okay.
Because salt is needed.
Okay.
It should not be taken in excessive amount.
Okay.
Avoid the table salt.
Okay. Oh, okay. Okay.
Yes, you should not keep the salt on the table.
Okay. So once the food
Otherwise,
is
they will
cooked,
keep
it
on
is done.
adding the salt, and it will increase the excess salt intake.
Oh, okay, okay. And there's one more thing that drinking red wine or having sweets reduces the level of hypertension.
No. See, again, this is a myth and
Okay.
some misunderstanding. But red wine or these things, they don't decrease the blood pressure, and there is no such scientific papers. Let me tell you, they support this increase intake of wine or these things will reduce the blood pressure. So we should
Okay.
not rely on this information.
Okay. And can blood pressure be treated with home remedies and natural supplements?
No, again, there is no scientific data about it, and we should not rely on this type of remedies.
Okay.
We should take the medications and not this type of remedies.
Okay.
So this information is very important for the patients.
Okay, so doctor, one last question. Do you have any message for this current modern generation who is having very different kind of lifestyle than the previous generations? Do you have any message for those people?
Yes, I would like to prevent hypertension, and what are the preventive measures that young generation can take? Very important. So first is stress-free life is very important. Next is salt intake reduction is important. Then taking fatty foods or saturated fats, means those content in the junk foods we have to avoid.
Yes.
Then obviously they have to do the regular physical activity, at
Yes.
least 150 minutes per week, at least
Yes.
alternate day. Twice a week resistance exercise is must.
Hmm.
And avoid alcohol, avoid smoking,
Okay.
avoid high intake of caffeine.
Hmm.
Nowadays, if, younger people come with blood pressure,
Hmm.
and surprisingly, we have seen that high intake of caffeine increases the BP.
Okay.
And they have to check the blood pressure at least annually.
Hmm.
And if it is increased, then take the medication as advice. Don't check it, nothing will happen.
True. Correct. Yes.
This message I want to give to the younger generation so that we can prevent the complications.
Okay, so thank you so much, doctor, for joining us today. And these were my questions. And I am sure that this information is gonna help tons of people out there. So thank you so much again.
Yes.
And I am Rupal, and this was today's episode of Heart Talks. Thank you.